Have you ever noticed that your ringing gets louder when you clench your jaw, or when you're stressed, tired, or even chewing? Let me ask you something very important. What if your tinnitus is not coming from your ears at all? What if it's coming from your jaw? Stay with me, because this might completely change how you understand that constant ringing. I want to tell you about someone I met recently. Her name was Margaret, 72 years old, a warm, gentle woman, very active, loved reading and spending time with her grandchildren. But she came to me with one very frustrating problem, a constant high-pitched ringing in her ears, day and night. She said, "Doctor, it never stops. I hear it when I wake up, and it's still there when I go to bed." She had already tried so many things: hearing tests, normal; ear scans, normal; medications, no real relief. She felt stuck. And more than that, she felt dismissed, because everything looked fine, but she didn't feel fine. Then she said something that caught my attention. She said, "I've also had jaw tightness for years, especially when I'm stressed." So I asked her a simple question: does your ringing change when you move your jaw? She paused, tried it, and her eyes widened. It gets louder. That moment was the key, because what Margaret was experiencing is something many people don't realize. Your jaw and your hearing system are deeply connected. Let me explain this in a simple way. Right here, just in front of your ears, is your jaw joint. It's called the temporomandibular joint. You use it every time you talk, chew, yawn, even when you're stressed and clenching. Now here's the surprising part. The muscles and nerves that control your jaw are closely linked to the nerves that process sound. They share pathways, they communicate, and sometimes they interfere with each other. Think of it like crossed wires. When your jaw is relaxed, everything flows normally. But when your jaw is tight, tense, or misaligned, it sends extra signals into your hearing system, and your brain tries to make sense of those signals, but they're not real sound. So what does your brain do? It creates a sound, a ringing, a buzzing, a high-pitched tone. This is one type of tinnitus, not caused by damage in the ear, but by tension in the jaw. Now let me ask you something. Have you ever noticed your tinnitus changes when you clench your teeth, move your jaw side to side, press near your temples? If yes, this is a very strong clue. Your tinnitus may be coming from muscular tension, not just your ears. Now here's something even more fascinating. There is a small part of your brain called the dorsal cochlear nucleus. You don't need to remember the name, but you do need to understand what it does. It acts like a control center for sound. It receives signals from your ears, but it also receives signals from your face, your neck, and your jaw. So when your jaw is tight, that control center gets overloaded, and it starts mixing signals. Real sound and body tension signals get blended together, and that creates a phantom noise. This is why some people say, "My hearing test is normal, but I still hear ringing," because the problem is not always in the ear. Sometimes it's in the communication between the body and the brain. Now let's talk about something very real: stress. When you feel stressed, what happens? Your shoulders tighten, your neck stiffens, your jaw clenches, often without you realizing it. Many people clench their teeth during the day, and even more, do it at night while sleeping. This constant tension puts pressure on the jaw joint, and over time, it can trigger or worsen tinnitus. So now you might be thinking, does this mean my tinnitus can improve? Yes, in many cases it can, especially when the cause is linked to jaw tension. Let's talk about what you can do. Simple, practical, effective steps. First, become aware of your jaw. Right now, as you're listening to me, ask yourself, is your jaw tight? Are your teeth touching? If they are, gently relax them. Your teeth should not be touching at rest. This one small habit can make a big difference. Second, practice jaw relaxation exercises. Open your mouth slowly, move it gently side to side, release tension without forcing anything. Do this a few times a day. It tells your muscles it's safe to relax. Third, apply warmth to the jaw area. A warm compress near your cheeks can reduce muscle tightness and improve blood flow. Fourth, avoid excessive chewing. Chewing gum all day or very hard foods can overwork the jaw. Give it rest. Fifth, pay attention to stress. This is a big one, because stress feeds tension, and tension feeds tinnitus. Simple breathing exercises, short walks, quiet moments can calm your system. And when your body calms, your tinnitus often softens. Now here's something many people overlook: your sleep. If you grind your teeth at night, you may not even know it, but your jaw knows and your ears feel it. If you wake up with jaw soreness or headaches, this could be a sign. In that case, a dental professional may recommend a night guard, something simple but very effective. Now I want to share something important with you. Not all tinnitus is the same. Some come from hearing loss, some from circulation, some from medications, and some from the jaw. This is why understanding your own pattern is so powerful, because when you understand the cause, you stop guessing and you start healing. Let me reassure you, you are not alone in this. I see this every single week. People who have been told everything is normal, but they are still suffering. And when we look deeper, we find the connection. And when we address it, things begin to change. Slowly, gently, but meaningfully. Now let me ask you something. Have you ever noticed your tinnitus change with jaw movement? Does it get louder when you're stressed or clenching, or quieter when you're relaxed? I would really like to hear your experience, because when you share, you help others understand their own symptoms too. And sometimes that one realization is the first step toward relief. Now, let me leave you with this thought. Your body is always communicating with you. The ringing you hear is not random. It's a message, not of damage, but of imbalance. And when you listen carefully, you can respond with care, not fear. So instead of fighting the sound, start understanding it. Support your body, relax your jaw, calm your mind, because sometimes the path to quieter ears begins with a softer jaw. And when that tension fades, something beautiful happens. The noise loses its power, and you regain yours, one step at a time, with patience, with awareness, and with hope.